show you the foster. Thank you for inviting me. You know I love when your family's in town. I always feel like part of the gang. Hold on, Mr. P. Mr. P. Yes, you, old man. You and I have beef, okay?
Hi, Eunice. Eunice, can you hear me?
Hey, Suki. Yes, I can hear you.
Okay. I've only got like 2 people waiting in the lobby.
I think maybe people will join like as it gets like closer to the time, and some people maybe they'll join like maybe 5 minutes late.
Okay.
Yeah, maybe let's wait for now, not let them in yet. We'll let them in at like 30.
Yeah. I can't see my speaker.
You can't see the speaker yet. Oh no.
Oh gosh.
What's the time zone?
I don't know. What time is it in Chile?
Who's in the lobby now? So,
Oh, it's Philip, Norma, Felicia, Tanya, Fraser.
yeah.
Like 5 people.
Ooh, okay. But it's fine. Don't panic. She'll join now. Do you have like, but send an email. Pop an email.
Yeah, let me send an email.
Okay. I'm just driving home. I'm almost at home though. I was at the office.
Okay. All right,
Yeah.
cool. How about the office?
Okay, sharp. In 3 minutes, 5 minutes, I'll be settled.
Okay. All right, cool. I'll start it now.
Okay, sharp.
Hello, everybody. Thank you for joining. I'd like us to give an extra minute or so. There's still a few people that we're admitting, and then we'll begin shortly. Perfect. I think we'll just continue admitting people as we go. I don't want to waste a lot of time. Hello, everybody from around the world. I see we have friends from Chile also joining us. So we'll begin the meeting by giving a brief introduction on our program today, and we will then I'll introduce our speaker today, Camilla, who will be giving the presentation, following which we will have a quick Q&A session. Please be aware that you will not be able to speak. However, you are more than welcome to engage with everybody in the Q&A chat box. We'll take questions at the end of the presentation, and hopefully we'll have a spirited and exciting discussion. So again, welcome everybody. I'd like to introduce myself. My name is Zukiswa Zimela, and I am the communications manager for HEALA. HEALA is the Healthy Living Alliance, and we are a coalition of civil society organizations that advocate for equitable access to affordable, nutritious food in South Africa by building a more just food system. We also, one of the ways we do this is by conducting advocacy campaigns to educate officials, civil society, communities, and the public about actions that government can take to build a more equitable food system. The reason we're having this discussion is because, you know, following global trends, a lot of South Africans are consuming more and more ultra-processed foods. And, you know, half of all South Africans are overweight or obese. And the World Obesity Federation anticipates an additional 10% increase in... Sorry, yes, you can. We are recording. We are recording, Philip, and we'll be sharing this at the end of the event. I'll start again. Half of all adults in South Africa are overweight or obese, and the World Obesity Federation anticipates an additional 10% increase in obesity among adults by 2030. We know that obesity and overweight hugely increase the risk of non-communicable diseases in sufferers. Overweight and obesity are costing South Africa's health system 33 billion rand a year. So we know that South Africa is in the midst of a health crisis. Earlier this year, the National Department of Health released for public comment. Earlier this year, the National Department of Health released for public comment the draft regulations on mandatory front of pack warning labels in an effort to allow people to make better food choices for themselves. You know, should the government have its way, and over 12,000 South Africans who lent their voice in support of the regulations, all food and beverages that have high levels of salt, sugar, or saturated fat and fall within a high-in threshold will receive a warning label. So in 2016, Chile implemented the law of food labeling and advertising that includes the first national system of mandatory front-of-pack warning labels on sugar-sweetened beverages and ultra-processed foods. The law was guided by Chile's nutrient profile model that helps them identify which foods and drinks are high in sugar, saturated fat, sodium, and energy. This law was implemented over 3 phases with increasingly strict nutrient thresholds. To date, researchers have evaluated the impact of the regulation through the initial phase and found that the regulation has led to a decline in the purchase of unhealthy food and children having less exposure to the marketing of unhealthy food while not impacting the economy. Our guest and presenter today, Dr. Camilla-Coalition, will share the lessons learned from Chile and why South Africa could benefit from front-of-pack warning regulations. So I'll give a brief introduction to our guest and speaker, and then we will continue. Awesome. So Dr. Kovalan is a surgeon, a master in public health, and a PhD in nutrition. She is the director of the Center for Research in Food Environments and the Prevention of Chronic Diseases associated with Nutrition, CAIPEC, at the Public Health Unit of the Institute of Nutrition and Food Technology at the University of Chile. CAIPEC is part of the international network Informas for monitoring food environments and also carries out policy evaluations such as the Chilean labeling law. CAIPEC works in coordination with several governmental bodies. I think it's really important for us to hear from other countries that have, instituted the policy. And see how for them it has worked and how South Africa can also benefit from this policy. So if Camilla, you can begin your presentation and I'll hand it over to you. If you can just give us a few minutes, we seem to be having technical issues. We're going to resolve those shortly.
Hi, hello.
Hello, we can hear you and see you.
Oh, okay, sorry for that. We had some technical issues, but it seems like now it's working. So thank you very much for the invitation. I'm very happy to be here with you today, sharing the experience of Chile. I think it has a number of similarities to what is going on in South Africa, and hopefully we can share some of our results and also some of our learnings. So I'll try to share my screen now. Let's see. So include computer sound. So let's see. Sorry, 1 second, is requesting some some security permit. Sukiswa, maybe I can send my presentation and maybe you can show it.
Sure, please do.
So we don't. Okay. Okay, so whenever you're ready, just you can start projecting. I will, in the meantime, start. So basically, the Sukiswa was presenting a little bit the scenario in terms of our nutritional problems. We are observing an important increase on food insecurity issues, particularly in some subgroups, and undernutrition related problems such as stunting are still very relevant worldwide in some specific countries. However, at the same time, we have been observing that the population is starting to consume products that we have termed ultra-processed type of products. And these products are basically products that have suffered a number of transformations, and at the end, basically, we cannot actually observe any trace of food, actual real food. And the issue with this is that they don't only have a big content of nutrients that will hurt the population, but also there are a number of changes on the food system that are a matter of concern. So as a result of this increasing consumption of ultra-processed food, we are now facing on top of the stunting and undernutrition crisis, a crisis that is related to obesity and the related chronic risk factors. So, Sukiswa, if you can advance. Next. 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 Yeah, so basically, what we are facing right now is this challenge, this nutritional challenge in which a vast proportion of the population are confronted with the issue of a double burden of malnutrition, in which we can see that without solving the problems related to undernutrition, we are now observing problems related to overnutrition, obesity, and chronic diseases related to a poor diet. Next. So in this context, basically nutritional problems have emerged as as the most important single factor for determining the health and mortality of the population. The last estimates speak of about 1 out of 4 deaths associated to nutrition. Next. And therefore, the challenge that most of the countries worldwide are confronting is a challenge that relates to the fact of decreasing the consumption of unhealthy food, this ultra-processed food, but at the same time promoting the consumption of fresh food, such as fish, vegetables, fruits, seafood, etc. Next. The problem is that these changes require for people to make a change. And we could think that that's something more or less simple to achieve, but the evidence has shown that really it's very difficult to make these changes, particularly if you live in an environment that doesn't really promote you to have healthier dietary patterns. And also because we have big companies, big food companies that have become a very relevant actor in the food system, and they are actually promoting the consumption of these unhealthy foods. Next. So there is this idea that we actually need to work to make the environment of people a healthier one, one that promotes the consumption of healthy food. And not only that, but we have to do it with a very comprehensive view, because we are not exposed to a single environment. We are actually exposed during a day to different type of environments, and therefore we need to support the transformation or the change on dietary behavior through all these different environments. Next. So with this in mind, in 2016, Chile approved the food labeling law. The idea was actually to promote healthier food environments to support healthier dietary behaviors, particularly among children. Next. Chile is a country that is very far away from South Africa, but we share, unfortunately, some commonalities with South Africa. We are in South America, but we also have very high rates of obesity. 3 out of 4 adults have either obesity or overweight, and 1 out of 2 children suffer from excess weight when they enter the school. Next. If we check the dietary patterns of the Chilean population before the establishment of the regulation, we can observe that about a third of the total calories of the population come from ultra-processed food, and another important proportion also comes from processed food, particularly from the consumption of bread. Chile is the second country worldwide in terms of higher consumption of bread. In contrast, the amount of calories that are coming from fresh food is also about a fourth. Next. As a result, when we check the compliance of Chileans with the WHO nutrient recommendations, what we observe is that almost all the recommendations are exceeded. This is much more clear for sodium, but it also happens for free sugar, total fats, and saturated fats. Next. And as a logical consequences, when we observe what are the main risk factors for premature deaths and disability in the country, we observe that high body mass index and unhealthy diets are the primary cause of premature death and disability. Next. So with this in mind, the Chilean food labeling law was aimed, as I mentioned, to provide a healthier food environment to modify diets with the specific goal of decreasing the consumption of these nutrients that have been related to nutrient-related chronic diseases. So decreasing the consumption of sodium, saturated fats, total sugars, and energy. And the policy is innovative in the fact that it combines 3 areas of actions to try to support this transformation. Next. The first piece of the regulation is related to front of package labeling. It's the same idea of the regulation that has been discussed on South Africa. This is the minimum, and it's related to improving information. We need to know what we are eating, and when we have to select our foods, we define that only packaged food that have an addition of sugar, fat, or sodium would be subject of the regulation, and then based on a nutrient profile model that was developed for the country, we define which were the limits for energy, sugar, saturated fats, and sodium to for the food products to be carrying these labels. Next. When the law was passed in Chile, we had to define what kind of labeling to use on the front of package, and we rely on a number of studies that were based on neuro behavior when you have to decide, and that they chose that when you do your decision, you may basically have seconds for deciding what you would be purchasing, and therefore you need to have a very simple and direct message to provide to the consumers. Next. So, in collaboration with a number of colleagues from psychology department, from the economic behavioral department, we conduct a study in which we tested different kind of signs and colors and combination of messages to end up defining that the one that behaved the better on these experimental designs were the stop signs, black stop signs with a message that says excess of the critical nutrient. However, we finally implement this stop sign with a message that says high in, because the regulation, the law, had defined a priori that this should be the message included in the label. Next. So the second important component of our regulation is related to marketing restrictions to children. This is a very comprehensive regulation that includes restricting the exposed to marketing by regulating TV marketing, but also includes other components like the use of characters on packages. Next. So our MAM doesn't have those friends in the packages. Next. We ban some products that would give toys as an incentive for promoting consumption if they were classified as unhealthy. Next. We also had restrictions on menus of fast food restaurants. So, for example, in Chile, the Happy Meal of McDonald's has had to change their content and include options that are healthy and that allows them to be below the limits defined by the regulation. Next. And we also restricted the possibility of doing promotions or contents or any other kind of incentive that would promote the consumption of products that have been classified as unhealthy. Next. Finally, the third component, it was related it was targeted to children, and it was related to promoting healthier school environments. It's really nursery school and school environments. And what the regulation says is that food products that are unhealthy will not be allowed to be delivered by free. That means in the school feeding program, or promoted or advertised on school and nursery school settings. Next. So this is how a supermarket in Chile would look like. There are aisles in which most of the products are carrying a label. There are aisles in which none of the products carry a label, and others in which there is a combination of products with and without labels. Next. Overall, what we have been doing in our research at the Institute of Nutrition and Food Technology in collaboration with several colleagues in Chile and in the US is trying to show, following a theory of change framework, whether this legislation has had an impact. Next. So first of all, we have been collecting data on food products. More than 10,000 products have been followed from before to after the implementation of the regulation. We can see that about half of the supply has some kind of label. Most of the products have either 3, 2, or 1 labels. And the most common one is the energy label, followed very closely by sugars, sodium, and saturated fats. Next. So based on our theory of change, the first thing that you want to see is whether people, once you implement the label, whether people are actually recognizing the label and understanding the label. So we have run a number of studies showing that people are actually able to see the labels and that they are very easy to understand. But here I'm also showing a cross-country study. This is the International Food Policy Survey, in which Chile participates with other countries such as Canada, Mexico, the US. And what we do in this study is interview adolescents. Adolescents are very difficult to change their behavior. And here we are asking whether they see the labels that are in the packages and whether the labels are easy or not to understand. And in green, we have the answers of the Chilean adolescents, in which we see that they significantly see more this stop sign compared to their peers from the other countries that don't have this label. And also we see that the Chilean adolescents declared that it's significantly more easier to understand the stop sign compared to the nutritional fact panel that is present in the other countries. Next. So we also have confirmed this information by conducting qualitative work. The results are very consistent. We interview mothers of children of different socioeconomic status, and all the mothers value importantly the regulation. They think it's good to be informed of the content of the foods. And here you can see some of the quotes that we obtained that basically show that some of the mothers were surprised by realizing that products that they have thought were healthy were not really healthy based on their content of sugar or sodium or fats. Next. So based on the theory of change, after confirming that the label is seen and is understood, you expect that the label will be able to actually provide some information to the people. And here we are presenting the results of an experiment conducted in 2 longitudinal studies in mothers of preschoolers and in adolescents in Santiago, Chile. And what we are asking these 2 groups is to define whether a juice that has a high content of sugar is healthy or not. And what we consistently observe is that after the implementation of the regulation, the classification of the juice as unhealthy increases in both groups. Next. The improvement is about 30%. Next. So basically the label is seen, is understood. It provides a clear message that allows people to identify products that are unhealthy. Now we would like to see whether the label is used. And again, here I'm presenting data from the International Food Policy Survey, where we see that the Chilean adolescents declared to use this information significantly more than adolescents in countries in which there is not such a front of package label. Next. But of course, we understand that people can always tell us things that they are not really doing. Sometimes we tend to be more optimistic about our behaviors. So we also went and checked directly on purchases. We had access to a data set that has national representation and that allow us to check how the purchases, the food and beverage purchases, evolve from before the implementation of the policy to after the implementation of the policy. And what we observe is that the purchase of high-in products and healthy products decrease both in terms of calories and the regulated nutrients. And it was partially compensated by an increase of non-regulated products, but overall the net effect is a decrease in all the regulated nutrients, so decreases on purchases of saturated fat, on sodium, on sugars, on calories that are consistent independently of the socioeconomic level of the household, and that really provide some results that are of a relevant magnitude. I'm here highlighting that, for example, in the case of sugar beverages, the impact that we see with the regulation is even larger than the impact that has been described with sugar taxes. Next. So we have also been following a cohort of preschool and adolescents from the southeast area in Santiago to trying to characterize how their dietary patterns change during the period of the implementation of the law. We have not observed significant changes in the case of saturated fat, but we do observe significant decreases in the consumption of sugars and sodium, both in the preschoolers and the adolescents. Next. And when we go and try to specifically check what has been going on the school environment, we have very limited evidence on what happened on the kiosk that suggests that there was a decrease, an important decrease on the selling of the unhealthy food products. As you remember, this is part of the regulation. Next. But we also know that there was a immediate compliance from the school feeding program in terms of the regulation, changing products that were classified as unhealthy by the regulation for a healthier option. And this is reflected in this analysis of Gabriela Fretes, in which we can see that, again, in these cohorts of preschoolers and adolescents, we can see significant decreases on the consumption of sugars, fats, and sodium at the school level. Next. This is, again, in line with the analysis that we have conducted in the International Food Policy Survey. Here, there is a comparison of the intake of unhealthy food products through the school feeding program in the participant countries, and you can see that the consumption in Chile is the lowest. Next. And in contrast, when we check what's the consumption of fruits and vegetables, we observe that Chile is the country in which children that are beneficiaries of the school feeding program have the highest consumption of fruits and vegetables. Next. So basically, if we follow the recommended theory of change for this policy to have an impact, we have gone through each of the steps showing that each of them have a positive response. And then that's in the side of the consumer, but also the theory of change suggests that part of the positive effect will come from the supply side, from the industry. And we have also evaluated that. Next. Together with colleagues from the School of Journalism, we have analyzed all the media, written media, TV, online, radio, to assess the attitudes and responses of food producers. And what we have observed is that at the beginning, prior to the implementation of the law, there were a number of arguments on the news related to economic problems, to legal issues, to complexity of the regulation. Next. But these kind of arguments decrease importantly after the implementation of the regulation, and we start actually to see some other frames that are more related to how industry can cooperate to solve the problem of obesity and NCDs, and also that this kind of regulation can become an incentive for creating a healthier type of products. Next. So we have also analyzed a little bit what has happened in terms of the use, in fact, of the absence of labels on as a marketing strategy. And there were some important companies in Chile who managed to get rid of the labels, and that they actually have been promoting that their products are free of labels. Next. We have followed these food products also in terms of their nutrient content. We have been able to show that there was an important reformulation, so about a 7% decrease on the number of products that have a label, and this is mostly derived from reformulation due to sugar and sodium. It's important to note that the Chilean regulation was passed before the PAHO nutrient profile was approved, so it didn't include non-caloric sweeteners, something that has been included in new regulations such as the one in Mexico or in Argentina. Next. Finally, because these economic threats were something very relevant for industry and different actors, we conducted, in collaboration with Guillermo Paraje, an economist from the University Adolfo Ibáñez, a series of analyses that have shown that the implementation of the regulation did not have an overall impact on employment or salaries on the food sector. And we have cross-checked this with at least 2 different type of data sets, and the data is very consistent in showing that although there might have been some decreases, these were compensated by increases in other industries, and the overall net effect is null. Next. Just to start to finalize, say that we have conducted new qualitative studies during the more intermediate implementation of the regulation that have shown that the regulation is not only allowing people to understand which kind of foods are unhealthy, but also they have increased the value that the families have in terms of the intake of more natural and fresh foods. Next. So in conclusion, our analysis from the Chile experience show that the regulation could be successfully implemented. We have a very high rate of compliance. The people understand the labels and actually value very much the policy. We have consistent, very high rates of support from the civil society. People are using the labels when they have to decide what to purchase, and this is reflected in concrete decreases on the purchase of the food that carry the labels. The industry has responded, reformulating their food products, and even using the absence of labels as a marketing strategy. And overall, we have not seen an impact on employment or salaries on the food industry sector. Next. So very rapidly, some of our lessons are that we have been able to show that prior to the implementation of the law, although there was a big discussion in the country for several years, we cannot observe any change or transformation on the quality of the food supply. All the changes that we observe take place after the implementation of the regulation and are very driven by the cutoff limits that were defined in the regulation. For us, this is a clear signal that without mandatory policies, it's going to be very difficult to achieve some of these changes. Next. We have also observed prior and during the discussion and the implementation of the regulation, a strong opposition from some big food companies through different medias. There were some legal arguments that were all defeated in the legal courts related to freedom of commercial expression, and then to the right to property because of the marketing regulations. So we need to be aware that food industry are going to be very active, very strongly organized to respond to these kind of regulations. Next. So in the Latin American region, we have learned that the way of actually defeating that opposition and that control on the media and the messages is actually to work together. We have created a coalition in which researchers and civil society are interacting to promote other type of progress in terms of food environment and food systems in general. And we do believe that the virtuous partnership between civil society, academia, and other actors that are really engaged on promoting healthier food systems is the way to go. As you can see here in the map, this was started in Chile, but it has been now implemented in several other countries. And as I comment, it has been improved, this regulation, based on the learnings of the Chilean experience. And we think we can also be very useful in the discussion that is now taking place in South Africa, but hopefully also in other countries of Africa or Asia. Next. So just to remind you that this, of course, has a cost, but the cost is clearly overseen by the benefits, and that there is now clear evidence that it's going to be very, very difficult to achieve the developmental goals if we don't keep in mind that nutrition is going to be essential for the achievement of those goals. So really a need, an urgency to keep insisting and progressing on this area if we really want to achieve our sustainable development goal. Thanks.
Wow, that was such an amazing presentation. Thank you so much, Camila. I want to remind everybody that you can ask your questions on the chat or in the Q&A box. So thank you very much. I would like to kick off, maybe if I could just kick off the discussion by asking a question or two. So it's interesting for me that you mentioned, you know, that regulation took place. One of the things that we often talk about internally as HEALA is, you know, improving the entire food environment. When you go to the shops now, 80% of the food that's available on the shelves is ultra processed. What would you say is the benefit of, you know, of reformulating as a way to improve the food environment?
Well, I think that's an excellent question. I mentioned very briefly that in the case of Chile, we didn't regulate non-caloric sweeteners that are a key component of the definition of ultra-processed food. Just to expand on that comment, what happened in Chile was that when we had to write the law, there was a big opposition of using the term ultra-processed food because it's not defined on codex. It's not accepted in international agencies. So we have to come around with this alternative definition of saying foods that have added sugar, sugars, saturated fat, or sodium, and we didn't anticipate that could lead to this reformulation, basically driven by non-caloric sweeteners. That we know there is a concern of the high consumption of them, particularly in pregnant women and infants. So what other countries have done right now is to include in the definition of the regulation also the possibility of non-caloric sweeteners, and in this way they will be also regulated. Overall, my feeling is that we will have to be tracking what happens when companies reformulate food. So now it's no non-caloric sweeteners, but it can be other kind of additives. There is very interesting experience checking what's the effect of some type of additives and what are their metabolic effect in particular. And I think that we will have to be monitoring that. I think that the key message here is that we don't want only people to be moving within categories to healthier options. We really want to promote the movement from this ultra-processed food to fresh and minimally processed food. Our learning is that probably we will have to combine policies to achieve that. We need policies that on one side are decreasing the consumption of ultra-processed and on the other side are promoting the consumption of minimally processed food. We think that that's even more relevant in the context of the double burden. It can help to achieve more food justice. So we need to think on taxes and subsidies, on marketing regulations of ultra-processed, but then marketing campaigns or social campaigns for minimally processed, and so on. So that's my view.
Amazing. We have a question from Nadia Flexner. Nadia says, thank you very much for this great presentation. Have you observed any plateau effect on this impactful results from the Chilean law in the last few years? So maybe if you can have a discussion about label fatigue, which you've seen from the consumers.
Yeah, I think that's also an excellent question. We know from the theory that interventions that are based on images tend to have a plateau and a fatigue level. In tobacco, that has led to the recommendation of actually rotating the images and so on. In our case, we have some evidence of fatigue that comes from the qualitative studies in which the mothers say that at the beginning they were shocked, surprised, but then they basically learn the message and then they continue to see the labels, and then they don't provide new information. And also because when we see the longer term effects on purchases, rather than seeing so in Chile, the law was implemented in phases, in increasingly stricter phases. So we were expecting to see increasingly higher effects, and actually we see that the effects remain. They did not decrease, but they did not increase. So it's basically we reach a plateau on the effect, and then it remained. So we think basically the recommendation should be to have periodic social campaigns, probably target to children that have been very, very relevant on this dissemination of this policy, to keep the awareness and the use of the labels, and also reminding that this is just one tiny piece that it's related to providing information, but it allows us to link other policies to these labels. So right now in Chile, we're discussing the possibility of a tax, and the idea would be that all the foods that have the label would be subject to the tax. So, so there are other externalities of the regulation.
That's a very bold move, knowing how people tend to feel about taxes. But I think, you know, anything necessary to just keep the regulation effective and impactful. So one of the things that we're struggling with in South Africa, we're still in the early stages, obviously, of this process, is, you know, industry coming out with certain things, talking about how companies will leave the country if this is implemented. And I'd like to just tie this in with a question from Stasia Norton, who says, you know, what was some of the reaction from the food companies initially? And how did you guys overcome that? Because I think the initial struggle is the pushback that we can expect from industry players.
Yeah, I think I tried to mention that. I think those are excellent questions. I think industry will never be quiet or silent about these regulations. They know that that will impact their sellings. I think that's a signal that we are moving into the right direction. So I think that the idea of gathering and getting collective support for pushing forward, I think it's the right way. I think that we need to think on all the arguments that the industry will use, and we need to respond with evidence to each of them. In particularly, the economic threat is something that always come into the agenda, is something that really our politicians hear. In the case of us, the evidence is very concrete. As I said, we have tested with different data sets, and we can show that there was no important exit of companies, no decrease on employment, no decrease on salaries. And really, this is very consistent also with economic analysis that have analyzed what happened with taxes or other kind of policies, in which we also hear a lot that the industry will disappear, that there are going to be massive changes on the workforce. And then at the end, what we see is the industry is very capable to accommodate changes. They just react to the new environment. They create new products. They can respond. They move. They prioritize other lines of food products, and they remain there existing and being part of the agenda. But I think it's relevant to realize that they will be always very coordinated and very powerfully trying to create division, trying to misinform people. And the key for me is that we are all aligned and working together to try to provide unbiased evidence and show what's really going on.
So we have a question from Philip. Philip says, great presentation, Camila. I'd like to know how, what the political will from the politicians was in Chile, and what lessons our government can take from the Chilean model to fight against industry bullying.
So I'm not sure if I understand correctly the question, but just to try to characterize a little bit the political and economic context in Chile. Chile is a very neoliberal country. It has a free market, and it has been recognized in the region as a country that has a very low rates of poverty and has done very well in terms of economic indicators. However, at the same time, we are one of the countries that have poor health and a very bad health environment indicators. So a very clear example of what happens when you only take care of economic indicators. So in the case of Chile, it was very relevant that economists started to realize that there was a negative externality on the increase of these diseases. We were very able in the early stage to show the cost in terms of premature death, disability for the health sector, but also for the economic sector in terms of leaves, absences, of this massive epidemic of obesity and unhealthy eating. And for us, I think that was very critical because economists started to think about this very in a practical and dogmatic way. And in that perspective, we were able to recruit there was a very strong senator who was a champion in terms of leading the discussion through the Senate and through the government, and actually recruiting some parliamentarians that were from different political views to actually champion for this kind of regulations. So I think it was somehow virtuous because we had this champion in the Senate, and then we also had a Ministry of Health that was particularly strong in terms of promoting and showing that other experiences were not working. I mean, Chile was trying to decrease obesity or promoting healthier food for the past 2 decades without any success.
Okay. I'll take 2 more questions. Yeah, we'll see how it goes. We have one from Mbuso who says, excellent presentation. How did the regulations impact on people living with type 2 diabetes in terms of improving sugar levels, A1C cholesterol, blood pressure? And he also wants to know if you got any support from the pharmaceutical companies.
We haven't, that's a very good question. We haven't really analyzed by subgroups what has been going on. We are right now doing on the overall population some check-ins on some metabolic markers to see if we can see some trend. What we have done is, yes, to characterize that people who have some particular diseases, it could be diabetes, but also hypertension, in the studies in which we collected their attitudes and their response, we see that those groups are particularly supporters, because for them, it has been historically an issue checking these kind of things on food products. So they were particularly positive in terms of providing this in a clearer way. And what happened with the pharmaceuticals, really in this discussion, I would say they were not really involved at all. In general, in Chile, pharmaceuticals have been very against public health measures, unfortunately, and we have actually have some issues related to the price of medicine. So really more, I would say, a more negative kind of a position than being an ally. The medical societies and the nutritional societies were good allies in Chile. There was the possibility of, they had some concerns and some doubts. There are always differences, but we were able to to be together and be supporters all together on this, and that was helpful.
So I think finally the last question, there's a concern about which foods will have a FOP warning label. We have a question here from Tanya Fraser, who says she's concerned about she manufactures dried fruit snacks, and she's worried that her product will be in the same bucket as chocolates. But I think this brings to the fore the importance of actually having a nutrient profile model, and perhaps you can talk a little bit about that and how the decisions were made using your nutrient profile. Just to emphasize, South Africa has its own nutrient profile that was researched locally with local researchers, but perhaps you can take that question, Camilla.
Yeah, so I think that there is always this concern, and we try to do as much as we can, and it's an ongoing process. I think each country has to test how the different nutrient profiling works in their context. So I think the work that has been done in South Africa is great. In the case of Chile, dried fruit would not carry a labeling because only foods that have addition of critical nutrients were subject to the regulation. So, for example, an avocado, although it has saturated fat, would never carry a seal. In the case of, for example, peanuts with the addition of salt or saturated fat, of course, would have a label. But then what we observe is that there was increasingly a transformation from that kind of peanut to peanut that doesn't have any kind of addition, and then they don't have any label on them. So basically, in the case of Chile, the way that we define the limits, it's based on nature. We analyze which were the labels that the levels of sugar, saturated fat, and sodium that you would observe naturally on a series of foods that you would find on the nature, and then based on that we define which should be the limits. And I think it makes sense to base the limits on what the nature is naturally providing to us. There are other profiles, and I think it's something that you can always be revisiting and improving. As I mentioned, if you miss something or new additives appear on the food supply. So yeah, so I think that's a critical component. And I think for me that the message should be that we should be promoting as fresh as possible the consumption of fresh and minimally processed food as possible.
I mean, obviously we could have this discussion for hours and hours, especially because we have you here. But I don't see any questions on the left on the Q&A or in the chat. I think I'd like to just thank you very, very much for your time. As South Africa who's starting out in this process, I think it gives us some insight on some of the things that we can expect. And it also just puts into sharp relief why it is that we need it in South Africa. Like you said, we have very similar issues that we're battling here. And so it gives us hope. And it's a vital mission for us. So thank you very, very much, Camilla, for your time. Thank you, everybody who participated in the webinar. And thank you for your excellent questions as well. We will download and save this and put it up and share links for people who perhaps missed the remainder of the webinar. And thank you for understanding our initial glitch when we had a few technical bloops. But it was well worth it. So thank you very much. Thanks, everybody, and goodbye.
Yeah, thank you, and best luck.